All right, welcome to Physiological Factors Affecting Pilot Performance. Now, Title 14 Code of Federal Regulations, Part 107, does not allow operation of a small unmanned aircraft if the remote pilot in command or the person manipulating the controls or the visual observer is unable to safely carry out his or her responsibility. And of course, it's the remote pilot in command's sole responsibility to ensure all crew members are not participating in the operation if impaired. Now, while drug and alcohol use are known to impair judgment, certain over-the-counter medications or OTC medications and medical conditions could also affect the ability to safely operate a small UA, such as certain antihistamines, decongestants, which may cause drowsiness. Part 107 prohibits a person from serving as a remote pilot in command, a person manipulating the controls, the visual observer, or other crew member if he or she has consumed any alcoholic beverage within the preceding 8 hours, is under the influence of alcohol, has a blood alcohol concentration of 0.04% or greater, or is using a drug that affects the person's mental or physical capabilities. Now, there are certain medical conditions, such as epilepsy, which may also create a risk to operations. But again, it's the remote pilot in command's responsibility to determine if their medical condition is under control and if they can safely conduct a small UA operation. So, physiological factors affecting pilot performance. Important medical factors that a pilot should be aware of include the following: hyperventilation, stress, fatigue, dehydration, heat stroke, and of course the effects of alcohol and drugs. Now, hyperventilation is the excessive rate and depth of respiration leading to abnormal loss of carbon dioxide from the blood system. This condition occurs more often among pilots than is generally recognized, and it seldom incapacitates completely, but it causes symptoms such as increased breathing rate and anxiety, leading to unconsciousness. Pilots encountering an unexpected stressful situation may subconsciously increase their breathing rate, and common symptoms of hyperventilation include visual impairment, unconsciousness, lightheaded or dizzy sensation, tingling sensations, hot and cold sensations, and even muscle spasms. A treatment for hyperventilation involves restoring the proper carbon dioxide level in the body. Breathing normally is both the best prevention and the best cure for hyperventilation. In addition to slowing the breathing rate, breathing into a paper bag or talking aloud helps to overcome hyperventilation. Recovery is usually rapid once the breathing rate is returned to normal. Conversely, breathing too slow or shallow results in hypoventilation. Stress is the body's response to physical and psychological demands placed upon it. The body's reaction to stress includes releasing chemical hormones such as adrenaline into the blood system, increasing metabolism to provide more energy to the muscles. Blood sugar, heart rate, respiration, blood pressure, and perspiration all increase. The term stressor is used to describe an element that causes an individual to experience stress. Examples of stressors include physical stress, such as noise or vibrations, psychological stress, such as fatigue, and psychological stress, such as difficulties at work or personal situations. Stress falls into two broad categories: acute stress, which is for short-term stress, and chronic stress, which is for long-term stress. Acute stress involves an immediate threat that is perceived as a danger, and this type of stress triggers a fight-or-flight response in an individual, whether the threat is real or imagined. Normally, a healthy person can cope with acute stress and prevent stress overload. However, ongoing acute stress can develop into chronic stress. Now, chronic stress can be defined as a level of stress that presents an intolerable burden, exceeds the ability of an individual to cope, and causes individual performance to fall sharply. Unrelenting psychological pressures such as loneliness, financial worries, and relationship or work problems can produce a cumulative level of stress that exceeds a person's ability to cope with the situation. When stress reaches these levels, performance falls off rapidly. Pilots experiencing this level of stress are not safe to fly and should not exercise their airman privileges. Pilots who suspect they are suffering from chronic stress should consult a physician. Fatigue is frequently associated with pilot error. Some of the effects of fatigue include degradation of attention and concentration, impaired coordination, and decreased ability to communicate. These factors seriously influence the ability to make effective decisions. Physical fatigue results from sleep loss, exercise, or physical work. Factors such as stress and prolonged performance of cognitive work result in mental fatigue. Now, fatigue falls into two broad categories: acute fatigue and chronic fatigue. Acute fatigue is short-term and is a normal occurrence in everyday living. It is the kind of tiredness people feel after a period of strenuous effort, excitement, or perhaps lack of sleep. Rest after exertion and 8 hours of sound sleep ordinarily cures this condition. A special type of acute fatigue is skill fatigue, and this type of fatigue has two main effects on performance. Timing disruption, appearing to perform a task as usual, but the timing of each component is slightly off. Disruption of the perceptual field, concentrating attention upon movements or objects in the center of vision and neglecting those in the periphery. This is accompanied by loss of accuracy and smoothness in control movements. Acute fatigue has many causes, but the following are among the most important for the pilot: mild hypoxia, oxygen deficiency, physical stress, psychological stress, depletion of physical energy resulting from psychological stress, and sustained psychological stress. Acute fatigue can be prevented by proper diet and adequate rest and sleep. A well-balanced diet prevents the body from needing to consume its own tissues as an energy source. Adequate rest maintains the body's store of vital energy. Now, if suffering from acute fatigue, a remote pilot should not operate a small unmanned aircraft. If fatigue occurs during the operation of a small unmanned aircraft, no amount of training or experience can overcome the detrimental effects. Getting adequate rest is the only way to prevent fatigue from occurring at all. Chronic fatigue extending over a long period of time usually has psychological roots, although an underlying disease is sometimes responsible. Continuous high stress levels produce chronic fatigue. Chronic fatigue is not relieved by proper diet and adequate rest and sleep, and usually requires treatment by a physician. An individual may experience this condition in the form of weakness, tiredness, heart palpitations, breathlessness, headaches, or irritability. Sometimes chronic fatigue even creates stomach or intestinal problems and generalized aches and pains throughout the body. When the condition becomes serious enough, it can lead to emotional illness. Remote pilots should avoid flying their small unmanned aircraft without a full night's rest, especially after working excessive hours or after an especially exhausting or stressful day. Remote pilots who suspect they are suffering from chronic fatigue should consult a physician. Now, dehydration is the term given to the critical loss of water from the body. Causes of dehydration are hot temperatures, wind, humidity, diuretic drinks such as coffee, tea, alcohol, or caffeinated soft drinks. Some common signs of dehydration are headache, fatigue, cramp, sleepiness, and dizziness. The first noticeable effect of dehydration is fatigue, which in turn makes top physical and mental performance difficult, if not impossible. Flying your small unmanned aircraft for long periods in the hot summer temperatures or at high altitudes increases the susceptibility to dehydration because these conditions tend to increase the rate of water loss from the body. Now, to help prevent dehydration, drink 2 to 4 quarts of water every 24 hours. Since each person is physiologically different, this is only a guide. Now, most people are aware of the 8 glasses a day guide. So if each glass of water is 8 ounces, this equates to 64 ounces, which is 2 quarts. If this fluid is not replaced, fatigue progresses to dizziness, weakness, nausea, tingling of hands and feet, abdominal cramps, and extreme thirst. The key for pilots is to be continually aware of their condition. Now, most people become thirsty with a 1.5 quart deficit, or a loss of about 2% of the total body weight. This level of dehydration triggers the thirst mechanism. The problem is, the thirst mechanism arrives too late and is turned off way too easily. A small amount of fluid in the mouth turns this mechanism off, and the replacement of needed body fluid is delayed. Other steps to prevent dehydration include carrying a container of water in order to measure daily water intake, staying ahead and not relying on the thirst sensation as an alarm. So if plain water is not preferred, maybe add a sport drink flavoring to make it more acceptable. Limiting daily intake of caffeine and alcohol. Again, both are diuretics and stimulate increased production of urine. Heat stroke is a condition caused by any inability of the body to control its temperature. And remember that. The onset of this condition may be recognized by the symptoms of dehydration, but it has also been known to be recognized only upon complete collapse. So to prevent these symptoms, it is recommended that an ample supply of water be carried and used at frequent intervals, whether thirsty or not. So the body normally absorbs water at a rate of about 1.2 to 1.5 quarts per hour. So individuals should drink 1 quart per hour for severe heat stress conditions, or perhaps 1 pint per hour for moderate stress conditions. And again, for more information on water consumption, just refer back to the dehydration section of this chapter. Now, the federal aviation regulations do not include any specific references to medication usage. However, Title 14 of the Code of Federal Regulations prohibit anyone from acting as a remote pilot in command or any other capacity while that person knows or has reason to know of any medical condition that would make the person unable to meet the requirement for the medical certificate necessary for the pilot operation, or is taking medication or receiving other treatment for a medical condition that results in the person being unable to meet the requirements for the medical certificate necessary for the pilot operation. Now, we want to interject that a medical certificate is not required in order to obtain your Part 107 remote pilot certificate. The FAA is rather just placing that responsibility back on the remote pilot in command. So Title 14 Code of Federal Regulations, Part 107, and subsections prohibit the use of any drug that affects the person's faculties in any way contrary to safety. If a remote pilot is in question regarding the effects of any over-the-counter medicines, they should consult with the Pilot Handbook of Aeronautical Knowledge. Now, the safest rule as a remote pilot in command or any crew member is just to simply abstain from taking any medication unless approved to do so by the FAA. And if there is any doubt regarding the effects of any medication after reviewing the Pilot Handbook of Aeronautical Knowledge, consult an aeronautical medical examiner before flight. Now, of course, alcohol impairs the efficiency of the human body, and studies have shown that consuming alcohol is closely linked to performance deterioration. Pilots must make hundreds of decisions, some of them time critical, during the course of a flight, and the safe outcome depends on the ability to make correct decisions and take appropriate actions during both routine and abnormal situations. The influence of alcohol drastically reduces the chances of completing a flight without incident, and even small amounts of alcohol can impair judgment, decrease sense of responsibility, affect coordination, constrict visual field, diminish memory, reduce reasoning ability, and lower attention span. And as little as 1 ounce of alcohol can decrease the speed and strength of muscular reflexes, lessen the efficiency of eye movements while reading, and increase the frequency at which errors are committed. While experiencing a hangover, a pilot is still under the influence of alcohol. And although a pilot may think he or she is functioning normally, motor and mental response impairment are still present. Considerable amounts of alcohol can remain in the body for over 16 hours, so pilots should be cautious about flying too soon after drinking. Intoxication is determined by the amount of alcohol in the bloodstream, and this is usually measured as a percentage by weight in the blood. Now, Title 14, Code of Federal Regulations, Part 91, specifically requires that blood alcohol level be less than 0.04% and that 8 hours pass between drinking alcohol and piloting an aircraft. Even though blood alcohol may be well below 0.04%, a pilot cannot fly sooner than 8 hours after drinking alcohol. And remember, it takes the body about 3 hours to rid itself of all alcohol in one mixed drink or one beer. Congratulations, we're moving on to the sample questions here. Dehydration is when your body has suffered a critical... Dehydration is when your body has suffered a critical loss of water. Heat stroke is a condition caused by any inability of the body to control its... And of course we know that's temperature. Many medications affect the body in ways contrary to safety. Which regulations govern the rules regarding medications for remote pilots? And of course, that's Title 14 of the Code of Federal Regulations. How long does it take for one mixed drink or one beer to pass through your body? That's right, we just reviewed that. 3 hours. And which is true regarding the presence of alcohol within the human body? Which is true regarding the presence of alcohol within the human body? And of course, that is judgment and decision-making abilities. And remember that most of these, if not all, will likely be on your exam. A physiological consideration to be aware of. Physiological consideration is both heat stroke and dehydration. Breathing too slow or too shallow of a rate results in an increased amount of carbon dioxide in the blood. And that is hypoventilation. And of course, too fast is hyper. You're hired to inspect power lines in an area 15 hours away from your office. After the drive, fatigue impacts your abilities. What kind of fatigue is this? It is acute fatigue. Fatigue can be recognized. Fatigue can be recognized as being in an impaired state. And last page, which would most likely result in hyperventilation? And of course, it would be the emotional tension, anxiety, or fear. The type of stress that triggers that good old fight or flight response in an individual, remember that? That would be acute stress. And then fatigue is one of the most treacherous hazards to flight safety because fatigue may not be apparent until serious errors are made. Congratulations, folks. You got past Lesson 11, Physiological Factors Affecting Remote Pilots. You are basically done. The Lesson 12, again, is a crash course review. Perhaps we encourage you to give it a try on the 9 questions and answers. Maybe after you review the crash course. And then after you review the 9 questions and answers, you'll see perhaps where you're falling a little short on. Re-review some of those lessons and chapters, and or feel free to go right into the 60 question practice exams. Whatever you decide, you can re-review these course materials as often as you need. Congratulations.